I am not an expert on the microphone. I want to say that now. My name is Lisa Bryant. I'm an estate planning elder law attorney in San Jose. Have been an estate planner now for about 8 years. Probably 80% of my business are seniors, age 70 and over. And this is all I do. Estate planning refers to leaving things to your heirs, and elder law is Medicare, Medi-Cal, long-term care, disability issues. So the first thing I wanted to talk about today was just estate planning basics. Wanted to let everyone know about a living trust. In California, if you own real estate worth $20,000 or more, you need to have a living trust. A will is not enough in the state of California to pass to your heirs. A will will trigger a probate process, which is a court hearing, which on average takes about 2 years to finally get through, and it's very, very expensive. A living trust can be administered in matters of weeks or months, depending on how everyone gets along and how quickly we can work through your assets. But if you do not have a living trust, real estate will go through a probate process and be very, very expensive. So you do want to make sure that you have a living trust if you don't have any other documents, if you own your home. If you have $100,000 worth of anything else that does not go by designated beneficiary form, you also need a living trust. A will is not enough. A will is only for people who own less than $100,000 worth of assets and no real estate in California. The other document you want to make sure you have is what's called a power of attorney for your finances. A power of attorney can come in two forms. It's known as a springing durable power of attorney, meaning that it springs into effect when 2 doctors certify that you are incapacitated and your agent steps for you. This is a document that you need when you are not deceased but incapacitated. I tell people this is a document for the living, so everyone needs to have this document. To help pay your PG&E bills, to close checking accounts, to talk to your insurance, all of these things require a power of attorney. The other form of power of attorney that you can do is what's called an immediate power of attorney. An immediate power of attorney just takes effect today. We forego the doctor certification. We allow your agent to step in and act for you today. And of course, there's different reasons and different ways you would do this depending on your health and the need of you to have an agent. But a power of attorney is a very simple document that everyone should have regardless of your wealth. It really just allows people to step into your shoes and take care of your day-to-day life when you cannot. The next document everybody needs to have is what's called an advanced healthcare directive, also known as a living will. Kaiser calls it 5 wishes. It's all the same document. The advanced healthcare directive says whether you live or die on life support, whether you want to be an organ donator, and if you had any special wishes regarding feeding tubes, pain medication, and also to your burial cremation. This document is very, very important. Like I tell people, what do Ted Williams, Terry Schiavo, and Michael Jackson all have in common? It sounds like a bad joke, but they did not have a healthcare directive. This allowed people to fight over their body, to fight over their care, and to create a serious family dynamic. You don't want that to happen to you. You want to make sure that your wishes are carried out and that your wishes are in writing. So you want to do an advanced healthcare directive. Any hospital you go to will supply this document for free. So do make sure that you ask for one whenever you go in and that you make sure that your agent knows your wishes as well. So whatever you're putting down, please let the person you name to carry them out know them as well. So those are the basics in estate planning: a living trust, powers of attorney for healthcare, and a power of attorney for your finances. Beyond that, what we want to kind of talk about is a little bit what the last speaker spoke of, is Medi-Cal and long-term care planning. What happens if you don't just die and you face a skilled nursing home situation? Medi-Cal pays for the first 20 days of a nursing home stay. And a nursing home is defined as a skilled nursing facility. Dementia units, Alzheimer's facilities, memory care, residential care, these normally do not qualify as a skilled nursing home. You really want to make sure that when you're talking about Medi-Cal, they only pay for a skilled nursing home. So in a skilled nursing home, Medi-Cal pays the first 20 days, I apologize. Medicare pays for the first 20 days of a nursing home stay. Day 20 through day 100, Medicare only pays so long as you make medical progress. Hip fracture, get better, go home, medical progress. The other things that put you into a nursing home, dementia, for example, you do not get better, you do not get cured. You may plateau and not get worse for a while, but if you are not getting cured, Medicare stops paying. When Medicare stops paying, your supplement stops paying. Blue Cross, Kaiser, whatever it may be, they are connected together over the age of 65. So you want to make sure that when one stops, the other is stopping. So at that point, what happens is after up to 100 days, most people make it around day 40, then you have to pay privately out of your pocket. The average cost in Santa Clara County for a nursing home right now is around $8,000 a month. Now that can wipe someone clean very, very quickly. If you average nursing home stay now, up to about 3 years. So at $8,000 a month, up to 3 years, you could really wipe out your savings very, very quickly. So what a lot of people do is they qualify for Medi-Cal, the state program, to pick up the difference. But Medi-Cal says you're only allowed so much money to your name. Healthy spouse, and I'm going to round these numbers, by the way, the actual numbers are in the booklet I gave you. Medi-Cal says healthy spouse, you can keep $109,000, a car, a house, and an IRA right off the top. And then sick spouse, you can have $2,000, the same house, and the same car, and your own IRA. Anything over that must be spent down in order to qualify. That's the term you'll hear, spend down. But the reality is you don't have to spend down. You can gift away. You can legally shelter and protect assets into different types of trusts. A living trust is not enough. A living trust only avoids probate. But there are other types of trusts in which you can legally shelter assets and still qualify for Medi-Cal benefits. For example, one of the trusts that I spoke of earlier is a special needs trust. A special needs trust is just a trust where we name someone else to be in charge, not yourself. You pick a trustee, let's say your child, and that trustee can use that money to pay for anything in which Medi-Cal does not pay for. And that's truly anything, trip around the world, brand new car, physical therapy, whatever it may be, so long as they are paying it directly to the vendor and not to you. So as long as it's there for your benefit, but not for your personal use, Medi-Cal says the money doesn't belong to you. It belongs to the trust. Therefore, it doesn't count. And you can shelter a lot of money in one of these types of trusts. Of course, they need to be set up correctly. There's different ways in which we fund them. You cannot fund a third-party special needs trust on your own. Please do not go out and start moving money and just sticking it into a trust fund. Speak to an attorney, and we want to do it right. But there are ways that you can actually shelter money and still qualify for benefits legally. The other part we want to talk about with Medi-Cal is recovery. When you die, Medi-Cal gets paid back. Anything they pay for you over the age of 55, they want to get paid back. So they put a lien typically onto your house when you pass, and that's how they get their money. Everyone's kind of heard the horror story, Medi-Cal took my house. This is what they mean by that, is that Medi-Cal put a lien against my house when I died, or when my spouse died, they're going to try, and therefore we're going to end up paying it back. A living trust does not give you any protection from Medi-Cal, but there are other types of trusts in which you can legally shelter your home. For example, one of them is called an irrevocable, intentionally defective grantor trust, fancy name, to simply say, again, we pick a trustee who is not yourself, let's say you're your child, you agree to limit the amount of income from this trust you may receive, but it's just a house, it's really not generating income anyway. And you also agree not to refinance, get a home equity loan, or a reverse mortgage, which most people aren't going to do. And if you agree to some of these things, Medi-Cal agrees that this trust is irrevocable and therefore a non-recoverable asset. And therefore, simply, Medi-Cal doesn't get paid back. It cannot lien against an irrevocable trust. So there's a lot of different types of planning that we can do for people who are facing incapacity. Right now, the laws are very, very generous. We can move money very, very quickly. We can move houses around from trust to trust, no penalty. You can do things and qualify people very, very quick in terms of moving money. Because right now, for example, Medi-Cal says that you can give away money in daily gifts. This is going to sound crazy as I say this out loud. Again, I'm rounding the numbers. But let's say Medi-Cal says if I hand you $20,000 of mom's money for you to put into a trust fund, Medi-Cal divides that by 5,000 and says you're disqualified for 4 months. 20,000 divided by 5,000, 4 months. However, if I give you $5,000 today, tomorrow, the next day, and the next day, same amount of money, I just did over the course of 4 days, you now qualify for Medi-Cal today. It's a crazy loophole in the law. But this is why you hire an attorney. Because Medi-Cal will never tell you these things. So you see that you can shelter and move money very quickly in different ways. Besides being able to give away money daily right now, I can give away money daily to as many people as I can find. You have 5 kids, I can give away $25,000 a day and shelter it and still qualify people for benefits. That is how generous the law is right now. They've been looking to change this law since 1996. We are the closest now that we have ever been. We are the only state not under federal Medicaid guidelines, so we are getting a lot of pressure to fill in a lot of these loopholes. So right now, like I said, what I've said to you is perfectly legal, but they're trying to change it, and most likely by the end of the year, a lot of these loopholes will be filled in. So what they're going to do is they're going to penalize you. That penalty can be anywhere from a month, depending on how much you move, up to 5 years. So we tell people, if you think you could be facing an incapacity situation down the road, and you do not have long-term care insurance, at this point you do not think you will qualify for long-term care insurance, you want to do this kind of planning now, because you want to outlive the look-back period. If you are good for the next 3 to 5 years, shelter your assets now, outlive your penalty of 3 to 5 years, your look-back period, and then qualify for benefits at the 5-year mark. And that way you would still get your Medi-Cal paid for once you're in a nursing home. So I tell people you always want to consider incapacity planning before you're truly incapacitated. Not to say that it could not be done. If you know someone right now who's in a nursing home paying privately, there's plenty we can do to shelter and protect them now, but you can never protect as much then as you can if you plan ahead. If you plan ahead, there's a lot of different things that can happen to shelter assets and allow people to qualify for benefits. The gentleman also spoke briefly on VA benefits. VA benefits work a lot like Medi-Cal. It's really based on your assets and what you own and what they say you can have. On average, the VA says you can have a house and up to $80,000, and then a few other miscellaneous type of assets such as prepaid burial, things like that. VA benefits come in different forms. One is just a pension benefit, in which you get simply for serving a certain amount of time and having a service-connected disability, and it's just kind of a flat thing you get a month. Another benefit is called aid and attendance. Aid and attendance is actually there to pay for a caregiver to come into your home, and therefore we have to show an expense of a caregiver versus your income versus your assets allocation in that, determining your VA benefit. And then when you're in a nursing home, there's also a benefit in which you receive from the VA. That typically is a $90 benefit you get while in a nursing home. So remember, aid and attendance is only for when you're in your home, and then once you're in a nursing home, it qualifies on a different level. But the VA, you do need to speak directly to VA representatives to qualify for that. You do need to have a service-connected disability, and you need to serve during a time of war. And a time of war, though, is broadly defined. You do want to look at the VA website and see all the different types of war that they determine to be, such as the Suez Canal, Grenada. There's other things that we originally just think of when we think of time of war. That's my brief overall of what people need, and I'd like to open it more up to the floor and ask questions, if anyone does have questions.
I write a trust, and my son is the one that's taking care. Then I have to go to him all the time to ask for my everyday expenses and my living, and how do I get money to live my life as I'm doing it now?
Very good question. If she sets up one of these special asset protective trusts, does she have to give up control to the trustee? And if so, how does this work? Yes, you do. There's a couple things. A living trust puts you in charge. A living trust is an extension of yourself. You are in charge of your own assets. Even though you name a trustee, they are a successor trustee. They don't step in until you die. A living trust, you manage your own affairs. But any other type of Medi-Cal protective trust, any type of trust used to shelter assets, you have to name a third-party trustee, such as your child. So you have to give up control. You have to get along with your kids. You need to trust them. Or we hire a professional. If you don't, like I said, there's all kinds of family dynamics, but you can hire a private fiduciary to manage this. But in reality, you have to give up control. Because if you can get your hands on it, Medi-Cal says we can get our hands on it. If it's your money, it's our money. But if you shelter it through a third-party trustee, that's the key. So how does this work? You have to submit your bills to your child, and they have to pay them every month from this trust account, and you have to give up a certain amount of control. If you're a married couple, Remember, healthy spouse, you got $109,000 in your name alone. You don't have to ask permission for. It's only for the assets you're sheltering above that. And the reality is, how much of that are you really touching? Because I find with a lot of my seniors, they put them in good investment accounts, and they're not really touching the money. If you're not really touching it, why not have someone else manage it for you? And therefore it's sheltered. But if you do need to access it, one, you need to work with your trustee, and then two, there's other ways in which to work around, depending on your situation with Medi-Cal or not, on loaning you money, on setting up different ways that these trusts can work. But in general, you need to give up control of your children, or to your trustee.
$109 you're talking about is for his...
It's called a community spousal resource allowance.
Oh, would you get it monthly forever?
No.
For your life?
Okay, the question is, if I do a Medi-Cal protective trust, do I have to work with my trustee? Can I manage my own money? That's the question.
Yeah.
The answer is no, you cannot manage your own money. You must work with a third-party trustee, because that's what Medi-Cal makes you do. Because again, if you had access to the money, Medi-Cal would say, pay your bill. You cannot have access to the money. But if you're a married couple, Medi-Cal says right off the bat, you get to keep as your community spousal resource allowance $109,000 in your own name, one time. So you have this account with your $100,000 in it, and the trust account in which your kids are managing for you. Your own account, you never have to ask permission. Go to Vegas, take a trip, buy a dog, whatever you want to do with your own money, it's yours. But the special needs trust account is managed by a third-party trustee. Typically a child, but it could be a private fiduciary. And that person, it manages and takes charge of it for you. So do you have to ask for permission to get your own money? Yes, because it's no longer yours. We gave it away to a trust. And it now belongs to the trust under the management of the trustee. So that's where we have to do a lot of balancing and playing on what can you manage and what can you give up. Sorry, I'm going to go with the man in the back and then back up to you, Jerry.
What happens if something happened to you? What does this special trust do?
If you are incapacitated and had a stroke, this trust allows you to qualify for government benefits, and all the money in it doesn't count toward your qualification, nor does it count toward recovery. It doesn't get paid back. If you die, this trust goes according to your wishes, just like any other trust, and leaves it to your heirs that have been designated, and it avoids probate.
How about the tax rate? Is it like trust tax rate?
It's at a trust tax rate. It files its own tax return. A special needs trust always files its own tax return. Typically on any income that it creates, it'll file taxes on that, which normally will not typically be a lot, but of course it depends on how much you fund this trust with. But it files its own tax return. And your child, your trustee, your private fiduciary, whoever you name, files it for you. They are responsible for the trust. Sorry, Jerry, you had a question?
Yes. How do pensions and Social Security figure into this?
And when you apply for Medi-Cal, Medi-Cal says you're only allowed so much income to your name. Healthy spouse, again, for a married couple, healthy spouse, you're allowed to keep roughly $2,800, and anything above that will be what's called your share of cost. They add up pensions, Social Security, required distributions from your IRA, all things that are considered income are added up together. The first $2,800 spouse gets to keep. The remainder is called a share of cost. But it's not to say that that is absolute. It is your minimum maintenance, your minimum monthly maintenance needs allowance is what they call it. But you can always go to court and ask for a court order to override Medi-Cal, to say, I need more money because I need a caregiver. I have needs at home. My husband, I can't afford to pay that and to care for myself. And the court typically favors that because they don't want you yourself to be in a nursing home and on Medi-Cal. So there's always ways around the income issue, but in general, you want to think the first $2,800 is exempt, the remainder is your share of cost, and then what are we going to do with that? Are you okay paying that, or do we need to go to court and ask for you to keep it?
That's $2,800 per month.
Per month. That is a monthly. The $2,800 is monthly. And again, that's a rounded number. The actual number is in the book.
What about divorce? about a healthy ex-spouse?
Your ex is your ex. You are considered single and have no rights to them, and they have no rights to you, unfortunately. Even though you get along, you're living together. Yeah, even though you retain assets together, technically you are divorced or legally separated, then your assets are your own, and you are now considered a single person. You're entitled to $2,000, and you get to keep an income of $35. That's what nursing home allows you to keep. Anything over that goes to your share of costs. So if you're single, very important to have documents in place and have trust set up to shelter a lot of this, because you are not given the benefit that a healthy spouse is given. Did that answer for you?
I don't know, I think it confused me. Are you speaking from the standpoint of the person collecting the documents from the healthy spouse?
Either person. You are no longer a spouse. Either your wife applies for Medi-Cal herself, she is now single and an individual. You apply for Medi-Cal as a single individual. Once you're divorced, there is no rights between you. So Medi-Cal does not treat you as a married couple. Regardless of your assets, your children, your income, the mixing, commingling that you
So
do.
the healthy spouse could hold all the assets, and Medi-Cal couldn't come and get them.
My understanding is she's not your spouse.
Right.
Could she hold all the assets? Yes. I mean, technically, can you give away your stuff? And you gave it to might as well been your neighbor, as opposed, whoever. Yes, but you will be penalized depending on how much or what you gave away and when you gave it away. But could it happen? Yes. I mean, you could do that, but there will be a penalty, which could right now be up to 36 months, and in the future up to 5 years. But let me tell you now, you do not want to give away your assets to anyone other than a trust for different reasons. For example, Medi-Cal says you can give away your house to your children. You don't even have to set up a trust for it if you don't want. Give it to your children. When you do that, they lose the step-up in basis tax-wise. It's always best to inherit property. You have an assessed value, and then you have the fair market value. When you inherit property, you get a step-up in basis. Your assessed value steps up to fair market value. You sell it, minimum to no capital gains tax. You give something during your lifetime. You have the assessed value. You sell it at fair market value. No step-up in basis. Therefore, you're going to pay capital gains tax from that assessed value to the fair market value, which can be significant depending on the home and the sale. 2, your children, your friend, your neighbor gets divorced. You gave this house to them. It is now their house, which means it's now half your ex-wife's house. Or you give it to your ex-wife, it's now her new boyfriend's house. You don't get it back. You gave it away. You lose rights and interests in that. 3rd, someone you know runs over a small child, gets sued. Your property is now up for their tax, for their debts, for their liability, for their paying back what they owe. You don't want to do that either. So always speak to an attorney before giving away anything. Because there's different trusts we can give it away to protect you, but not open it up to everything else.
They told us that we only have so many beds for Medi-Cal.
Okay. And this is the biggest myth out there in the nursing home industry. And it's very, very difficult for you as individuals to wade through on your own. This is why we work with attorneys or advocates or people. Because 1, every bed in a Medi-Cal facility is a Medi-Cal bed. There is no such thing as we only have 10, we only have a wing, you'll hear all kinds of craziness like this, and that is not unusual. Because Medi-Cal has the lower pay rate. Medicare pays more. Every 20 days, Medicare is guaranteed to pay. They want every 20 days to get a new person in there. Then, what ends up happening is if you pay privately, they can charge you out of your pocket as much as they want. But Medi-Cal is only going to pay to a certain amount, period. So they don't want a lot of Medi-Cal people in there. That's the reality. And I'm not here to bash the nursing home industry because there's a lot of reasons for this. But just know that no, every bed in a Medi-Cal certified facility is a Medi-Cal bed. Now, how do I know if it's a Medi-Cal certified facility? If you go to the website, canhr.org, canhr.org, and you click at the top, find a nursing home, follow it through and click the box, takes Medi-Cal. They will list every facility in the county that takes Medi-Cal. Now to know that, like I said, they may not have a Medi-Cal bed in their, what they deem to be their Medi-Cal unit, that's fine. But they have the right to put you into a room with 2 to 6 people in it, that you cannot control. And they have the right to move your room around within the facility based on their need of doing that. That's fine, we can't control that either. But they cannot kick you out for simply going from private pay to Medi-Cal. Once you're in a nursing home, and it is deemed by your doctor, you need 24-hour care, whatever that may be, they cannot kick you out by law, so long as you have applied for Medi-Cal benefits. So your bed is good. Just don't let anyone ever pressure you into that or thinking otherwise, that there's only so many beds in a facility. Not true.
In your experience, what percentage of the long-term care facilities accept Medi-Cal?
About 98% of all facilities take Medi-Cal. About 98% of all facilities will tell you they do not. You will get the story that this poor woman got, that we only have so many beds. So you do want to check it against the Canner website to know your rights going in. But they all take it. Saratoga Retirement. Don't know if anyone's ever been out there. It used to be the Oddfellows home. It's beautiful. Medi-Cal facility. The Terraces in Los Gatos. Beautiful. Medi-Cal facility. They take Medi-Cal. It's the dirty little secret of nursing homes that they do not advertise it because they simply couldn't afford for everyone to be a Medi-Cal patient.
So
Yes,
how
ma'am.
do you get, if you go in to speak to them and they say, well, we don't have enough Medi-Cal beds, how do you force them to take you?
There's a couple of different ways to get into a nursing home. One is to go into the hospital in what we call a qualifying 3-day bed stay. You must be admitted into the hospital 3 consecutive days and be discharged to a Medi-Cal facility for rehab physical therapy. Now please make sure you are admitted. I learned this the hard way. They can hold you for observation for 3 days and not admit you. So please make sure, for Medicare standards, you are admitted. If you are admitted and then discharged to a facility, then you go over there for rehab. Medicare is again paying the first 20 days and up to 100 days, depending on your prognosis. But at that point, then we transfer you over to Medi-Cal. They get a nice letter from your attorney saying, we plan to stay here forever. Have a nice day. And that's how you stay. Now, that's a great, from hospital to nursing home, there is a Medicare connection. So they take you, no problem. There's a pay source. From your house, your home, or your assisted living to a nursing home, they are not required by law to take you at all. Then they start vetting you. Then you have to apply. And this is worse than a job interview you've ever had. They are going to dig into your finances. They want to know how much care you need, what your family's like, how much drama you're going to bring. All different things go into play into this, where medications you're on, and they don't have to take you. So that's when you have to kind of do the show me the money. They want a down payment. And that down payment, it depends on the nursing home. It could be 1 month of care. Some of them right now are asking up to 9 months prepaid care. That I can't argue. That's up to them. By law, they can set their rate at whatever they want it to be. So what we do is you pay cash, we get you in the door, pay the first few months or whatever they're asking for, and then we apply you for Medi-Cal, and then they owe you a refund. This is why the nursing home industry, it's very difficult. And unfortunately, and I said, I'm not here at all to bash nursing homes because I said they are under so much incredible pressure and to make money and to try to sustain themselves with so many people that really at some points can't afford to pay. But this is how it works because you have to have an advocate, you have to have an attorney or someone working with you to know your rights because they're not going to share them with you. But we can get you in the door that way, and then we work on applying you for Medi-Cal and we work on getting your money back. But you always want to make sure that you have enough money in reserve should you need to pay your way in the door. Because I said a guaranteed 3-day qualifying bed stay is not, you don't know. I'm sorry, I'm going to go with this gentleman first.
Now you get to stay in the hospital for 3 days. I was in there in a stress fracture and they kept me overnight and said, you're healthy enough to go home. So most hospitals want to keep you out as soon as they can. They don't want you to stay there for 3 days.
Well, sir, you're healthy enough that you look like you probably could have went home. But let's say your loved one is not, or you're not sure, or your spouse cannot care for you. This again is where you kind of have to be your own advocate. You have to step up and say, I'm not taking her home. I'm not taking my spouse home. They can't kick her to the street. They got to find a place for her to go. If you refuse to take her there out, what are they going to do? Make them deal with you. Make them, we need to find a place. Because a lot with my seniors, simply a healthy spouse is just someone who lives at home. It doesn't mean she's healthy enough to lift and care for her husband. It doesn't mean that she can really perform the duties that are required for care. So we need to make sure that the nursing home, the hospital understands that, and we're not taking them home. We're not taking responsibility for them. They're going to have to discharge them to a nursing home. That's kind of how you kind of get into this 3-day qualifying bed stay, is again, you have to kind of force your rights and see where you really lie within that need of 24-hour skilled care. But many families are faced with that, and so what do? You go in the hospital and you try your best to get in there. And it really depends on your condition and what the need is at the time. But that's where it's very difficult. But once you're admitted for 3 days and sent to the nursing home, then you have the right to remain in the nursing home for as long as you need to, so long as you apply for Medi-Cal.
My husband, for instance, doesn't need skilled care, he just needs care.
Well, again, skilled care, yes. Any Parkinson's type, any specialization place, including dementia, memory units, things like this, do not take Medi-Cal. But skilled care is defined by your doctor, and it's just deemed to be a need for 24-hour care. So dementia, typically a lot of people don't think of it as being skilled care, but if your loved one is a wanderer, or violent, or can't take medication, or can't control their bowels, or whatever it may be, you just simply can't provide the care. It's skilled care. If they need somebody there 24 hours and your doctor has deemed that, it's skilled care. So that's where you'll kind of get a lot of feedback, is they'll tell you it's only Parkinson's, you can take care of it over here. That's where we have to work with your doctor and say, you know what, I don't have the money to care for it over there, or whatever it may be. And unfortunately, nursing home is the only place that takes Medi-Cal. It's not anywhere anybody wants to be, but it's where some people have to be, simply maybe financially even, because their spouse just simply can't provide the physical care needed for them.
My question was, if, let's say you come into a nursing facility on a private pay basis, and then you apply for Medicare, do they have the right to change the quality of service they're providing?
If I enter a nursing home as a private pay patient and I transfer over to Medi-Cal, can they change my quality of care? The only thing they can change by law is your room. You might have been in a really nice private room. You are now going to be in a room with minimum 2 people and most likely up to 6 people. But your quality of care does not change. The nurses on the floor, the people who are caring for your loved one day in, day out, don't know and don't care how you're paying. That is the truth. They really don't. They work really hard to care for your loved one and just do their job, and they don't know who's a private pay and who's not. The beds aren't marked. That's dealt with the administration. That's dealt with the corporate office on some of these nursing homes. They just don't know. I tell people, you want to get your loved one the best care in a nursing home? Don't worry about Medi-Cal or not. You take in cookies every day. You take something with you every day, and you thank those nurses for their time and their dedication, because it is hard work. I mean, everybody's been to a nursing home. Nobody wants to be there. But take something with you. Make them know that when you're coming, make them enjoy your being there, because your loved one might even be a pain in the butt. They might be a hard personality to deal with. They might be going through their own problems. You want to thank them for their time. Once you kind of make nice with the staff, they have no clue whether you're a Medi-Cal patient or not. It doesn't matter.
Would you repeat the CANHR website, please?
It's CANHR.org. That's the California Advocates for Nursing Home Reform.org. At the top of the page, you'll see a little box that says Find a Nursing Home. Click on that and follow it all the way through, and it'll tell you in every county whether the nursing home takes Medi-Cal or not. Because that way, when you call, you don't have to worry about what answer you're going to get on the phone. Because I'll tell you, probably 90% of them will tell you they don't. Or they don't know. The girl answers the phone, she doesn't know if they take Medi-Cal or not. Someone will have to call you back. They know. I mean, if you're at a Medi-Cal certified facility, you are. If you're not, you're not. And I said most nursing homes are.
And boarding care is not.
Boarding care does not accept Medi-Cal. Residential care, assisted living, memory units, all of these dementia facilities, Parkinson-only type facilities do not take Medi-Cal. It's really unfortunate that Medi-Cal only pays for a skilled nursing home. They do not pay for anyone to come to your home, except for, this is what I'm talking, there's two types of Medi-Cal. Long-term care Medi-Cal, which is what I'm speaking to, and community-based Medi-Cal. Community-based Medi-Cal is for those who are very low income, typically around $600 or so. And for that, you can qualify for IHSS, in-home supportive services. But to do that, it is very, very difficult. You have to not be able to meet the five activities of daily living: dressing, feeding, feeding, walking, bathing, and taking medication. You can't be able to meet these needs, and based on a worker who comes out to your home and assesses you, you get so many hours of in-home support. And then you end up paying what's called a share of cost. Part of your income goes to support that. So very few people actually qualify for a reasonable amount of hours to make it worth it in IHSS if we're at the point of talking about nursing home care. Because if you are at the point that you need 24-hour skilled care, IHSS will never be enough to help you. You will need to look into the skilled nursing component of Medi-Cal if you need that type of care. I offer a free consultation. It's always free to talk to me. I tell people that because it is an education. If you truly know someone who is facing incapacity or maybe already in a nursing home, you just want to plan. You want to make sure you have everything in place. I tell people I hope you die a natural death and never need anything I'm talking about. I really do. But if not, have something in place. Because once you get to a certain point, I don't want to say it's ever too late, but conservatorships, court proceedings, it's not the way anybody wants to go. So just make sure that you definitely plan ahead. If you currently have a living trust, I look at it for free as well and tell you if it's up to date and how good it is. So any questions, just always give me a call. So, thank you.